Gavin Yamey. I'm a professor of global health and public policy at Duke University, where I direct a policy lab called the Center for Policy Impact in Global Health. A very warm welcome to SwitchPoint COVID-19 Back to the Future. COVID-19 has altered our perspectives on a whole range of things. What we thought we knew about pandemics, economics, equity, affordable design, global pandemic preparedness has been turned upside down. A chilling example of the phrase hindsight is 2020. SwitchPoint and the team at IntraHealth International have asked experts from around the world, including me, to look back at their own words and warnings from their past SwitchPoint stage talks, particularly talks on epidemics and pandemics over the past years. Were they right about what was to come? Could any of us have imagined the science, the politics, the behaviors that led up to this very moment? We are going to hear from renowned global health leaders, activists, officials, engineers, fashion designers, economists, music and performing artists, and even a research science magician, all of whom have had their lives upended, like you, like me, and like all of us around the world. So, unlike many of the speakers that you'll hear from today, I didn't even make it onto the stage at SwitchPoint because of the pandemic. So, what was I going to talk about at SwitchPoint 2020 if I'd had the chance? Well, one of the things that I study as a professor at Duke University is the role of foreign aid in improving health. And in particular, our team at Duke studies ways to make aid smarter, that is, more impactful and more efficient in saving lives and improving health, particularly in the less wealthy part of the world. We also partner in 6 middle-income countries with think tanks, universities, ministries of health, and ministries of finance in studying ways in which these nations can become fully self-sufficient in financing and delivering health programs without aid. And my SwitchPoint 2020 talk was going to envisage a world beyond aid. So when COVID-19 hit, this research on foreign aid for health, on systems resilience, that took on a new urgency, a new focus. In the face of the worst pandemic in 100 years, instead of asking, how can we make aid smarter? We asked, what's the most effective way to use foreign aid to control and end the COVID-19 pandemic? And instead of asking, how can nations become self-sufficient in managing their own health systems, we asked, what can countries do now to become resilient in the face of crisis? And so we pivoted. Over the last year, we've worked on ways to finance and deliver COVID-19 vaccines. We helped to design COVAX, for example, a global facility for ensuring vaccine equity worldwide. And right now, we are studying some of the bottlenecks in less wealthy nations to deliver COVID-19 vaccines. At the same time, we are working with our partners in these nations on strengthening health services in this pandemic and post-pandemic period, including through new modes of healthcare delivery, like using telemedicine or digitally empowered community health workers or integrated teams of healthcare workers working together in the community. And if I had been at SwitchPoint 2020 to deliver a talk in person, I would have said, we absolutely need a revolution in foreign aid for health. I would have argued forcefully that we need to be financing what are called global public goods for health. Things like pandemic preparedness, action on climate change, research and development for diseases of poverty, tackling antibiotic resistance. Acting in this way and doing these things benefits all nations. They are truly global public goods. COVID-19 really showed us that we neglect these public goods at our peril. And somewhat ironically, a month before COVID-19 hit, I co-authored a study that showed just how little it would have cost to fund these goods. We found that for an additional $11.5 billion a year, we could have funded a range of these essential global public goods for health. Now, you might get sticker shock when you think about $11.5 billion a year. However, COVID-19 has killed at least 3 million people. It has infected at least 137 million people. And the International Monetary Fund estimates that the global economic loss from COVID-19 could be about $28 trillion. So compare $11.5 billion per year of an investment against $28 trillion in economic loss. That investment into global public goods is easily affordable, and the international community, we must make it happen. We are now in an era of pandemics, and it really is the case that an ounce of prevention will be worth a pound of cure.